Bunions are common, often unsightly, and sometimes very painful. The medical terminology for a bunion is hallux valgus. It is a deformation of this joint. It's not just a bump that sticks out, it's this joint deforming slowly over time. Someone who is predisposed to tilting inwards or rotating inwards when they're walking is going to have side pressure against this joint, which slowly over time deforms. A lot of people think that this is caused by high heels, but there are cultures on the planet that don't wear shoes that do indeed get bunions. Treating a bunion is not complicated. What we want to do is stop the inward pressure, the side pressure against the toe. We want to stop that inward rotation and stop the side pressure. Generally speaking, I cannot make a bunion go away, but we do our very, very best to make it not get worse. By designing an orthotic that will hold the foot in a more optimal position in how it interacts with ground forces, we can stop the side pressure against that joint, either in sports shoes, sandals, or in dress shoes. The other thing that we will do is measure the angle of the deformation so that we can tell when we see the patient in years to come whether or not we were successful and whether or not it got any worse. Measuring success with regards to bunion treatment is not easy because often there's no pain. But we like to set the bar at making sure that the deformation does not continue to get worse based on our measurements. And if there is pain, we want to get rid of it. That's where we set the bar, and that's how we measure success.